Good afternoon, everyone. Welcome to our 2024 end of the school webinar. You're going to hear today some updates from our KDE School Health Branch as well as KDPH School Health Branch. And we know it's a very busy time. So as we move through, I want to kick us off with a couple things. Next slide, please. As you know, this will be archived on our KDE media portal after the live stream is over. So if there's anything on here that you would like to go back and revisit, feel free to do that. Give us a few days to get that up, but that will be available, as well as posting of the PowerPoint presentation, which will be on our School Health Services webpage at KDE as well. In addition, since we're using the media portal, we would encourage you to access the soapbox link that is on the slide here. And if you have questions throughout the presentation, please feel free to put those in during while folks are presenting, sharing that information. We will then go back at the end of the session and answer the questions that you all have. If we do run out of time in regards to that, we will make sure that we do follow back up. I would also ask that if you would consider putting your name and or district in case we don't get to all the questions. That way we can directly report back to you as well. Next slide, please. So to kick our webinar off, I would like to share with you all a message from our interim commissioner, Robin Kinney. She was unable to join us today, but wanted to share this with you at this point.
Hi, I'm Robin Kinney, Kentucky's Interim Commissioner of Education. Today, I'm honored to recognize School Nurse Day and express my deep appreciation for the role school nurses play in our education system. School nurses are essential members of our education communities, providing support to our students, staff, and families. Their dedication to promoting the health and well-being of our students is paramount to student success in both school and life. From administering medications and first aid to developing health education programs, school nurses tirelessly ensure our students' health and safety. School nurses serve as pillars of comfort and support for our students and families, offering crucial emotional and mental health assistance. They also play a pivotal role in connecting families with community resources when needed, working collaboratively with teachers, counselors, and administrators to foster a safe and healthy learning environment. The work of a school nurse is challenging, yet profoundly impactful. They are at the forefront of promoting health and preventing illness, contributing significantly to our students' ability to reach their full potential. To all our school nurses, I extend my heartfelt gratitude. Thank you for your unwavering dedication, compassion, and commitment to the health and well-being of our students. On behalf of the entire Kentucky Department of Education, we extend our warmest wishes for a joyous School Nurse Day.
So thank you very much to Interim Commissioner Kinney. She is a huge advocate for school nurses and for the work that you all do each and every day in your districts. So we say an early Happy School Nurses Day, which I think is actually occurring on May the 8th. So we wanted to share that with you as we began our webinar today. The next item that we wanted to share with you are around legislative updates from the previous session. Some of these you may be familiar with, some of these you may not be. I will also preface this by saying this being a longer session this time, we have not had as much time or really any time to really go in and dissect what the specific actions and how we're going to fulfill some of these requirements. As we have a few more weeks to do that, we will then follow up with you as to what those specifics will look like. So, but we did want to make you aware of what is in the pipeline for the upcoming school year and beyond. So the first one is really an extension from last year, but there were a few bills that targeted AEDs. And the first one being House Bill 22. And all the ones that I am mentioning today actually passed. So we are not talking about any of those that went through at various points through the process, but only those that were successful in passage. House Bill 22 removed the physician oversight of AEDs, while owners, and for our practical purposes, we're talking about districts, but owners are still responsible to maintain and upkeep those AEDs, but it does not have to be signed off on or overseen by a physician. House Bill 169 requires that AEDs, that schools continue to increase the number of AEDs in their buildings and facilities as funding becomes available. We'll talk more about that just in a moment. It also requires reporting that was new last year. So each of the districts will be responsible for reporting to us at KDE by November 1st. The new part of this will be not only the numbers and the locations of those AEDs, but also it requires the name, the school, and the training date of each district employee that has been trained to use the AED. So that is something that we're trying to figure out as simple of a way for you to report that information to us. And we will be getting back with you on that. I also make a note that this is for all sanctioned athletic practices and competitions. Last year's bill only really targeted high school and middle school events. This year, it dips down into the elementary level. So all of those practices and competitions are part of this as well. Next slide, please. A third piece of legislation shows up in House Bill 1, which is related to the budget. So the General Assembly also provided $2.5 million to KDE in part of its funding that will assist schools in the purchasing of new AEDs for the next school year. So like I said, we are in the process of trying to figure out what that will look like, how that will take place, but know that there are funds there to assist in the coming school year at this point only. That does not preclude schools and districts from doing that on their own if they already have funds set aside. But this is in addition as a result of the budget. Next slide, please. A big conversation, not only in the General Assembly, but I think across the state and even occurring in the districts, is related to House Bill 29. House Bill 29 is also a follow-up from last year's Senate Bill 47, which was passed, but does require that medicinal cannabis will be legal and will be effective January 1 of 25 in the state. It did not expand the list of qualifying medical conditions, so that stayed as it was in the previous law. A few things that I would like to note on this bill. You see the third bullet there. A school shall not refuse to enroll or penalize a person who is a card holder or is a registered qualified patient. So we know that is, or unless it fails to follow federal regulations. So just for the reason that they have that status, that does not mean that we can refuse to enroll that child. Next slide, please. A few other pieces of the bill. Local boards of education are required to establish policies related to the provisional usage of this no later than December the 1st of this year, whereas the policy will go into effect on January 1st of 25. Also, I would note on the second bullet point, policies shall either permit the use of medicinal cannabis on school property or permit its use. So a school district can choose either way in regards to do that. And we'll go through just in a moment what those specifics look like. So as I mentioned, that policy must be in place by December 1 of this year. If a district chooses to permit usage, it must adopt policies to permit that student to consume medical cannabis on school property as deemed necessary by the parent or legal guardian. So that must be part of the bill or of the policy if they choose to go the route of allowing medical cannabis to be used. If also adopted, schools must designate a school nurse or other staff to administer the medicinal cannabis. But no school staff are required to administer or supervise the administration of medicinal cannabis. If they so choose not, then they are not required, even though that student may be a card carrier. Each district should have a system to track in place if a staff member does not or refuses to administer or supervise the administration of cannabis. And then LEAs or districts must create a policy for parent or legal guardian to administer the cannabis on campus. If the district says it can be administered, then there must be a policy for the parent or legal guardian to do so. A couple other pieces that I want to mention while we're on this. If a district chooses to allow administration of cannabis, the medicinal cannabis, then they must also designate a private space in which this can take place outside of normal viewing and where other people would see that occurring. And then the final consideration that I want to mention today is around storage. There would also need to be considerations as to how the medicinal cannabis would be stored if you have students or staff that are in this system or in this process. Next slide, please. Again, those are a lot of the things that I just went over, so we can skip through this. Tanya, next slide. There were several other legislation pieces that I wanted to mention today on the call. I feel like as school nurses and or district health coordinators, you may be in the conversation of some of these as we move forward. We are not going to talk about specifics on these, but I would encourage you, if you aren't aware or if you are a little curious about this specifics on these bills and now law, I would encourage you to dig a little deeper and or ask administrators, board, legal, whomever about these. The first one is around Senate Bill 2, and that's a follow-up from the School Safety and Resiliency Act. But this further defines some of the trauma-informed care, suicide prevention efforts in our schools. It also requires those plans to be sent to KDE and available for public review. So one of the issues was that folks we knew that districts had to develop those, but oftentimes folks were unaware of what were actually in those policies. The other piece of this is around districts are allowed and are permitted to hire armed guardians if they so desire in regards to school safety. House Bill 272 now permits pharmacists to give vaccines to children 5 years of age and older. Previously, that was age 9, I believe, but that now is going to be able to occur ages 5 and older. House Bill 11 there were a couple tobacco bills that actually passed this time. 11 looks at the creation of a list of tobacco retailers and non-compliant database and reporting system. So more tracking can occur in regards to who is selling. And then secondly, any Tobacco Control Act product cannot be sold to an individual under the age of 21 at this point, according to this law. House Bill 142, again, looks at tobacco and tobacco-related products. So tobacco, nicotine, and vapor-related products cannot be or are banned in school as we know it. It also requires the district to develop a procedure for those who violate or have possession of any of those types of products in the school as well. So there's I think there will be some more conversation around what is our current policy, and then there is very, very little about talking about cessation and helping these students be able to curb and knock that addiction. So that may be something that you all will be consulted on and or will be involved in within your local district or schools. And then finally, House Bill 611. This is going to impact, I think, in some counties more than others, but in all of our districts, requires school officials to file a complaint with the county attorney when a student has 15 unexcused absences. There's a lot of work going on right now around truancy, around child or student absences, chronic absenteeism. So that is now will go to a county attorney. One note related to that bill is that at the elementary level, then parents and legal guardians will be held responsible for that truancy and those unexcused absences of 15 or more in regards to that. Next slide, please. I am going to turn it over to Angie at this point. And I would encourage you, if you have questions, I'm not going to promise we'll be able to answer all of them, but we'll do our best. And if we can't, we will definitely get back to you. So I remind you to put those in the soapbox. Angie?
And first of all, just want to take a moment to echo Commissioner Kinney's message for School Nurse Day. I appreciate you guys, each and every one of you, more than you will ever know. I think about you daily and I worry about you daily. So, but we cover, so I'm just going to hop right in. Just let everybody know that there's no changes in our medication administration training program for next school year. We will have updated ELA certificates, and those will be available by July 1st. Just also wanted to remind districts, or maybe some of you that may be new to school nursing, that if your district is going to be providing any summer programming, the district's still responsible to have trained personnel there that can provide for the health needs of students. It does not have to be a school nurse, but you have to have someone there. Summer programming is still considered an extension of the school year, so that your delegation and training from this school year will be in effect up through June 30th. then anything you have after July 1st or after will need to have new training and delegation completed. If you need to request the test or the answer keys or any certificates, you can email Tanya Hickman, and I've put a link to her email address in the PowerPoint, so you'll be able to reach her. Next slide, please. Just wanted to talk for a minute about out-of-state field trips. That's always a hot topic amongst school nurses. Last year, I shared a little information about Tennessee, so this year I thought we'd talk a little bit about Ohio, since it's one of our neighbors. Next slide. In the state of Ohio, a nurse cannot delegate medication administration. However, school administrators can designate a staff member to administer it. That staff member can't be a volunteer. They must be a school employee, and they must be trained on medication administration by a licensed health professional. So your medication training program training would be sufficient for this. I've put a link to the actual law, and I encourage everybody to review that themselves before that you have field trips going to Ohio. And I just wanted to thank Ann Conley, who's the state school nurse consultant for Ohio, for sharing this information with us. And as she's been, we answer lots of questions about field trips amongst each other, and we get contacted from other states quite frequently. So just wanted to give her credit for where credit was due. Next slide, please. Just another reminder for field trips. As the delegating nurse, you're responsible to know the laws for any of the states you're traveling through as well on the field trip. So you need to keep that in mind when having out-of-state field trip. You can contact that state's Board of Nursing or the state school nurse consultant for that state. And I've put a link to the map for the National Association for State School Nurse Consultants, and it has all of our, you can hover on the state, and it will give you the information and an email address of the consultant in that state. Also, if you're doing international field trips, you need to work with the U.S. consulate in that country to find out what the requirements are there in that country as well. Next slide. Scope and practice for school nursing. The National Association of School Nurses has published a new book called School Nursing, the Scope and Standards of Practice. It's kind of a boring read, I will be honest. But thankfully, the National Association of State School Nurse Consultants has developed a summary of this book, and as well has developed a continuing education for school nurses. It talks about the scope and standards that can be used to help you to guide your school nurse practice and help you set up practice goals for your districts. Next slide. This offering consists of 3 modules, and if you complete all 3, you get 1.95 continuing education hours. This is free of charge to any nurses in Kentucky. I'm a member of this association and was on the review and edit team that put this together. So it's a really, really good program, and I encourage everybody to use it. You will be asked to create an account and log in, but like I said, there's no charge for performing it. As of mid-February, over 200 Kentucky nurses had already taken advantage of this and was the second highest response in the nation. So kudos to you who are taking advantage of this program. Next slide, please. We get lots of questions this time every year as districts are starting to think about possibly contracting with outside providers, with hospitals, FQHCs, clinics, or whatnot regarding school health services. And we get lots of questions on what should we make sure we include in this contract. So we have updated our guidance document. It's very thorough. It's gives a list of all the things that the school district is required to provide. And it's up to the individual districts to decide when you're developing these contracts, who is responsible for this. Ultimately, the responsibility lies on the district to make sure that it's performed. So if it's not addressed in the contract and the district thinks the clinic's doing it and the clinic thinks that the doctor's office or that the school's doing it, then we don't want things to slip through the cracks. And so hopefully this document will be of benefit. I encourage you to share it with your superintendent, your DPPs, and even your school board. Next slide. There is a new disaster training program. Just a second. Being provided by sorry about that. CHFS by the Department of Behavioral Health, Developmental and Intellectual Disabilities branch regarding disaster preparedness. This is not only for schools, but they have put together a training and a toolkit to basically help any community members who may be supporting students in the event of a disaster, whether it be COVID, tornadoes, flooding, school shootings, you name it. This toolkit and training is free of charge. And next slide, please. And walks you through lots of resources for families, teachers, schools, whatnot. This is, like I said, it's a free training. They're offering 12 free virtual trainings between the month of April through June. And you can click on the link there to register for the training. Once you do the training, then they will provide you a copy of the toolkit that you can use and take back to your districts. I would share it for anybody, any outside agencies or church groups or anything that maybe support the schools, because they could benefit from this toolkit as well. Next slide. For more information about this toolkit and training program, you should contact Amy Potts, and I've put her email address up there, so you will have that. Next slide. Next, I'd like to talk about some new resources provided by the National Association for School Nurses. The first one is a coordinated support system for students with epilepsy. This has been very thorough training that they've developed, and it has lots of resources for schools and districts to use when you're developing IHPs, action plans, whatnot. And also there is training there for clinical-based evidence regarding students with seizures and epilepsy. That's a mouthful. But these are all free for NASN members. And if you're not a member of NASN, and we'll talk about that in a little bit later, I encourage you to do so. Next slide, please. Other epilepsy and seizure resources I thought I would share with you, because we get lots of questions about that, is the Seizure Action Plan Coalition has some fillable seizure plans. They have some that are very basic, that have pictures if you're dealing with maybe someone who does not speak English and needs some visual prompts. That was great. The Epilepsy Foundation, it always has lots of information and seizure plans. And non-epileptic seizures, we're seeing more and more of those now. So I'm also sharing a couple resources from the University of Colorado and the University of South Florida. One is a parent guide, which is amazing. And then the Colorado has a seizure plan, sample seizure plan that you can use for non-epileptic seizures as well. Next slide. NASN, like I said, I encourage everyone to join if possible. Membership is $105 a year. They've made it easy. You can do it in quarterly payments. Your family resource and youth service centers may be willing to cover this cost for you because they have health requirements that they have to fill as part of their grant. So this may be something that they could do for the district. Members get free or reduced cost continuing ed hours. Like I talked about those resources that I just shared. But I think one of the best benefits is the vision vouchers that you can get free. It used to be called Sight for Students, and now they call it Eyes of Hope. And I'll talk a little about that in a minute. And then also, as a member, you have the opportunity to attend the NASN summer conference every year at the end of June, and it's an amazing conference. And you get to network with not only school nurses from across the country, but there are a lot of nurses come from other countries as well. So it's really neat to hear how school nursing is being carried out in Europe or whatnot. So it's a great conference to attend. Next slide. So the Eyes of Hope program, VSP will provide gift certificates for a comprehensive eye exam and, if needed, eyeglasses for students who qualify. They can districts can get up to 30 certificates a year, or each member can get 30 certificates a year. And it usually takes about 3 weeks to get those. And the NASN encourages you, if you request them, to kind of do it during the non-peak months because it may delay the time getting the voucher. But once they qualify, you give the parent the voucher, they take it to the eye doctor, and everything's covered. Next slide. To use a Eyes of Hope certificate, you have to have a family income up to 200% of the federal poverty level guidelines. I was actually surprised. You can make a little more money than I expected and still qualify. You can't have any vision coverage through a government program or through private insurance. And you do not have to have a social security number as well. And they only will provide one certificate every 12 months. And I've also included a link to the poverty guidelines so you can determine if the parents fall in that category. Next slide. Also want to talk about the benefits of joining our state association, the Kentucky School Nurse Association. This is a very, very inexpensive membership, $30 a year. It will allow you to network with fellow school nurses in your region as well as your state. You will have access to a regional delegate for KSNA and opportunities to attend any of the regional trainings and meetings, and to go to the summer conference as well to get CEU hours. Next slide. The U.S. Department of Ed has issued some new guidance documents regarding 504 protections for students with asthma, diabetes, and kind of surprised me with gastroesophageal reflux. Links to all these documents there, and I've also included this infographic on the profile of students with disabilities in U.S. schools. This is a very, very interesting infographic that goes deep down into how many with disabilities have health conditions. It even goes into how many are having trouble with attendance in school, discipline issues, or discipline. How many times these kids are being sent to the office for behavior or discipline. It's very, very eye-opening. So I encourage you to take a look at that, and even share with your administrators, because it's very, very enlightening. Next slide, please. This is a question that we get quite frequently about consents for treatments and screenings. Districts should make sure that you are getting yearly consent to treat students, period, for anything other than you can provide emergency first aid care, or if there's a life-threatening situation without consent. But other than that, you should not be providing health services without consent from parents. Even routine health screenings such as the vision and hearing should not be completed without signed parental consent. Just because our state law says that districts are required to do vision and hearing, that doesn't override the need for consent. You can combine the consent for this with your yearly consent, to provide care. And a lot of districts have even just included this as a question for their online registration processes. Next slide. I'm not going to read this word for word, but KDE's legal team had just kind of pointed out the laws regarding why we need parental consent, and they're there for you to read. But it's well documented in KRS 156-501. Talks about the informed consent for provision of health services by a parent or guardian. Next slide. The health services means provision of direct care, including in medication administration, operations or maintenance of school health, or use of medical equipment, or the administration of clinical procedures. Health services does not include first aid or emergency procedures, like I said before. If that child is in an immediate need, you do not need parental consent. Next slide. And then at KRS 158-191 talks about upon a student enrollment and in the beginning of the school year, the district shall provide notification to the parents listing each of the health services and mental health services that the district provides. And they have to give parent the right to withhold consent or decline any of those services. Next slide. The CDC has issued some new guidance regarding COVID-19. Now they basically are saying we should just treat it as any flu or any other contagious disease. Basically, you stay home when you're sick or you have a fever. You can go back to work or school 24 hours after being fever-free for without fever-reducing medications, like we've always done. Recommend going back to normal activities for the next 5 days that you're feeling better, but they are encouraging increased hand hygiene, mask use, physical distancing, steps for cleaner air, and whatnot. And I know the mask thing is going to be triggering for some people, but that's still in the recommendation. CDC has not updated their guidance documents yet, but plan to do so by the beginning of this upcoming 24-25 school year. But these are the guidelines that they're going to recommend, and districts can make their own decision on whether they want to lessen, their COVID policy or keep it the same. That's a district level decision. Next slide. Some upcoming training opportunities. I just want to remind everybody of the Kentucky School Nurse Association Summer Conference. This year it's going to be July 15th through 17th at the Embassy Suites in Lexington. And if you are a member of the School Nurse or District Health Coordinator listserv, there'll be more information coming. I saw they put the tentative agenda out there so people can use it and go on and start getting approvals at their district levels and whatnot. Any questions that you have regarding that conference, you need to direct to Pat Glass in Jessamine County, as she's the treasurer and secretary for KSNA. Also, NASN 2024 this year is going to be in Chicago. been a long time since there's been one kind of within driving distance. If you attend in person the entire part, you get 20 contact hours. They are offering an online conference at a different date, and these are totally different presenters and presentations than the in-person conference. And if you attend all of those, you can get 20 contact hours as well. The KSNA conference, Pat Glass has told me that participants, if you participate all 3 days, you will be able to get the 14 continuing ed hours required for our nursing license renewal. So you can get it all in one conference by attending there. Next slide. And now I'm going to turn things over to Tanya Hickman, and she's going to talk about Infinite Campus updates and give you some end of the year data reminders. Tanya?
Thank you, Angie. Again, my name is Tanya Hickman, and I will be touching on what reports are due to KDE when, share some important information and data from our health services infographic, and I see new look that is coming soon. This is a listing of what reports are due to KDE June 1st. These reports are pulled from Infinite Campus and will be posted to our student health data page. For specific data entry requirements, please review KDE's data standards. We get several questions about the health office visit report. There is an ad hoc report located in the state published folder that will show any health office visits that you have not entered a discharge date for. We recommend that you run this report frequently so you may correct these data entry errors as you go. The path to find this ad hoc report is under Ad hoc Reporting, Filter Design, State Published folder. One important thing to remember is rights have to be given to access the ad hoc report option in Campus. Plus, ad hoc looks at the user's overall tool rights. If there is a data element that the user does not have rights to view, the ad hoc will not return the data. Our school health data refers to our nurse school count report. School nurse counts should be entered before June 1st as well. Please note that the district point of contact is responsible for entering this information for district hired nurses. District hired nurses are tracked on the District Assignments tab, and contract hired nurses are tracked on the District Service Providers tab. Data checks can be done using the nurse count report located under KDE Reports. Infinite Campus has recently made changes in the immunization certificate report in the health section of IC. This was a core product change at the corporate level and not a change that we made or requested at the state level. We have figured out 2 walkarounds to get it to pull the information as before. Option 1, to get the report to pull a certificate date, the expiration date, and the certificate type for all students, you must check all the boxes under the certificate type and enter a date in the past in the first certificate date and expiration date boxes. This should pull all students and the certificate information as before. But note, I just chose a date that was far out in the past to make sure it covered any older students in the district. Option 2, to get the report to show only missing students or those with missing information or certificates that are expired currently or will expire soon, you will need to check all the boxes under certificate type just as before. But in the last certificate date and expiration date boxes, you want to enter June 1st, 2024, the deadline for the health data cleanup. This should only pull students who are missing information or will have an expired immunization certificate by June 1st. This option might be the best to run as it only shows kids that needs attention. I wanted to share with you some of the data that we collected last year. This is our school health services infographic. It breaks down our data into categories. Some of the reasons why this data matters. Kentucky school nurses are essential for students' well-being. Their care keeps students healthy and in class, reducing burdens on families and communities. They promote healthy habits, shaping a healthier future for all. And some of the highlights of our hard work of our school nurses across the Commonwealth this year, or last year, 134 out of 171 districts documented health office visits in Infinite Campus. Over 2.8 million health offices reported There were over 2.8 million health offices reported, and out of those, 93.84% of the students seeing return to class. 86.88% of students nationwide returned to class. We have over 117,000 chronic health conditions that were medically diagnosed by a healthcare provider. Asthma is the number one, and ADHD is the second one. Please note that the infographic is located on our student health data page at the Kentucky Department of Education's website. And finally, something new to look forward to. IC is getting a new look that will take place 2025 to 2026 school year. You can start now to explore the new look. Some of the improvements include a simplified navigation structure, responsive user interface design, quick access to recently used tools, and one that's not listed here is a favorites button. You can try the new look while you're in Infinite Campus by selecting the person icon. This box will appear, and you can turn the toggle on for the new look, and you're also able to turn it back off. I encourage you to start that process. Also, Campus Community has several videos that you can watch and learn how-to information. I plan to go in more depth about the new look this fall during our regional and district coordinators meeting. Jim, I'll turn it back over to you.
Thanks, Tanya. I also, before I turn it over to Michelle and hear from DPH, I did want to remind folks to go ahead and add your questions in the soapbox, and we will get to them shortly. So, Michelle, KDPH, it's all you.
All right. Thank you very much. Good afternoon, and so glad that I could be here with you all, and I appreciate the invitation from Jim, and I just have a short summary that I need to go over today. So what we're going to talk about today is the naloxone naloxone protocol. You know that I update those every year, and they go into the clinical services guide at the DPH in July is when they're posted. So there is a change to the naloxone protocol. Basically, what we've done is we are now calling it the protocol / medically approved guideline, and I'll explain why on the next. Let's start with the next slide. Next slide, please. All right, so here we go. So the clinical protocol for naloxone use in the school setting, and we are by regulation at the DPH responsible to produce this protocol, and I hope that you all know it exists, especially if you have naloxone at your schools. But I did want to show you how we have changed formally. Now it is included as a medically improved guideline for the over-the-counter use of naloxone in the school setting. All right, next slide. Just a quick summary of this is that naloxone, there was a regulation KRS 217.186 that says naloxone can be kept on the school premises. That KRS does link to KRS 156.502, which you know is the Health Services and Delegation KRS. It does also state that the school district must have a policy. So before you elect to have naloxone in your district, you have to have a policy that's developed, and I gave you the reference to that. And then the third thing is that the district must follow the clinical protocols developed by the Kentucky Department for Public Health, which is me, to address supplies of the opioid antagonists kept by schools and to give you advice on the clinical administration of the medication. All right, next slide. So I do want to show you kind of how the book has changed. The protocol, like I said, is now considered a medically approved guideline, and I'm going to tell you just in a minute why that matters. But because of this and the medication being over the counter, the medically approved guideline will cover the school nurse's ability to delegate over the counter medicine. So I've also expanded on the naloxone resource page and the references and resources. I have also included a copy of Dr. White's signature that is in the front of the clinical services guide. And Dr. White is actually signing for this medically approved guideline to be able to be used in the school setting. All right, next slide, please. So it also links to the Kentucky Board of Nursing, the advisory opinion number 16. And I've given you a reference here, medications and given in various routes. And you can see when a nurse as an employee provides a non-prescription medicine to an individual, the nurse should do so based on an order from the doctor or a medically approved guideline to supply the non-prescription medicine. And the KBN or the board recommends that any nurse who's educationally prepared and clinically competent as an individual who is acting outside of the health delivery system may choose to recommend or administer the non-prescription medication as long as it's in a pre-labeled, pre-packaged form to a person whose condition warrants its use. And I've given the link there to the actual AOS. All right, next slide. And I've also given you several other resources to support this decision on delegation. You can just kind of cruise through those at your leisure. And that's all, those links are all live in the PowerPoint. And on the bottom right-hand corner of the presentation there on that page, it actually gives you the link to the clinical service guideline, the clinical service book that we use at the DPH. All right, next slide. And then here are the expanded resources for naloxone. I've given you all kinds of resources here. The actual harm reduction program, lots of other things you can get on that page. I do also want to show you that the Find Naloxone Now Kentucky is included on this page. And these are all the different things that are there on that page. The governor was very proud, and they just recently released an updated web page, and all these sheets and information guidelines are included there on that page. All right, and that QR code, if you want to snap a quick pic of it, it will take you to the page. Next slide. This is expanded and reorganized the references and resources page as well. It gives you all the links and anything that you might need to develop and to implement naloxone at your school district. All right. That's it. Thank you. If you all have any questions or concerns, please feel free to reach out. I appreciate the time, Jim. Thank you.
Thanks, Michelle. Just a reminder, we may have had a lack of communication, but the soapbox link is in the chat. So if you were trying to find it or didn't have it, Megan has placed that in for your use as well. Just a couple more slides before we take the time to hear from you. A couple reminders. Earlier this week, there was if you can go back, just thank you. Earlier this week, there was a message that was put into the UK Nurse Listserv. And we're asking if you all will take a couple minutes. I promise it will not take any longer than that to complete a brief needs assessment for us in how our team can meet your needs in regards to school health and health services. And if you can do that by May 15th, we would greatly appreciate it. This will help us inform us of future training, technical assistance, etc., as we try to meet your needs and your kiddos' needs within your district. Secondly, more information will be forthcoming about this year's district health coordinator meeting, which will be scheduled in the fall. We hope to have additional information at KSNA in July too. I would also mention, I know it is an extremely busy time and can't believe it's already May, but we also realize that June will be here very soon. You're trying to wrap up school. You're doing extra duties in regards to field days and field trips and parties and all that stuff. But please don't let your June 1 deadline of submitting your data creep up on you as well. And feel free to reach out to our team if you have questions or problems that we can help you troubleshoot on that. Next slide, please. So wanted to take a moment to share with you We were actually talking as a team. Last year's end of the year webinar, we were still in a different division and branch at KDE. Since that time last year, we have created a new school health branch within the department. I wanted to share with you who those folks are. You will have email access to all of them when in the PowerPoint when it's shared. So I'm serving as the branch manager, Angie as our state nurse consultant, Tanya as our data person, our resource management an analyst. Caitlin is actually one of our 3 new staff persons that we have during this reorg and the creation of the branch. We now have 3 additional folks at the department, and they will serve as field staff for the eastern, western, and central portion of the state. So Caitlin will serve our eastern region. Crystal Dillingham will serve our central region, and Abby Henshaw will be serving our western region of the state. Crystal and Abby actually just came on yesterday, so they're in day 2 of their stint with us. We also have within our branch CDC funding that Kentucky has received in some form or fashion around healthy schools for the last 25 years. Stephanie Bungie is serving as Healthy Schools Project Director, and Jalen Stubbs is serving as our school health consultant and evaluator of that grant. So again, please feel free to reach out to us if there's anything that we can do to help you in regards to that. Next slide, please. So now it is time for us to be quiet for a little bit and see what questions you have, or if there's anything that we can clarify for you. And Megan, do we have any questions at this point?
There are no questions in the Go Soapbox.
We will pause here for just a little bit and give you time to, if you're typing or thinking of questions. We also,
Jim, I do have 2. I'm sorry to interrupt.
Sure,
We do have 2
ahead.
questions that had got submitted on our Google form that we had sent out prior to the webcast, and I'm happy to go over those real quickly while we're waiting. Okay. The first question was, how should we as nurses handle a situation where a student's pediatrician approves a student to self-carry an albuterol inhaler, but we as nurses feel like the student is not mature enough? The parents and the doctor have both checked off and signed off on the action plan. Any advice appreciated. My first thought is always I really, really think students should be carrying their emergency medications with them. My reason being this is, if in the event of a lockdown, that's going to be the time that kid's going to need his inhaler the most. If it's not with him, there's no way you're going to be able to get to them to take that inhaler to them. So you run the risk of, a life-threatening situation happening because that child does not have an inhaler with him. Granted, not every kid is competent to self-administer. What I what I did in my former district as a health coordinator was all of our students, even from the time they were in preschool, carried their emergency medications in a gallon Ziploc bag that had a copy of their emergency action plan and with it in there, and that stayed in that backpack at all times. The kids were taught from itty bitty on up, you don't take that out of your bag unless a grown up tells you you can take it out. The kids that aren't able to administer will at least have that with them, and a trained person can administer it to them. I tell them, say, when you get home at night, keep it in your backpack. If you use it, put it back in your backpack, because then that kid is covered on the bus. He's covered for any extracurricular activities. If mom and dad live in separate households and they're spending one night at mom's and one night at dad's, then that inhaler's always with them. And we always just put something on our form that for students who were not able to administer, that they would be, the medication would be administered by trained school staff or assisted by trained school staff. So that's one way I think we should get, could think about addressing that. I used to be the old school thing too when I first started as a school nurse. I had a drawer full of inhalers and EpiPens, and excuse me, sorry, can't sneeze, but I always sneeze in groups. I'm sorry, but we did a mock school shooting, and I was barricaded in the bathroom in the nurse's office for over 4 hours before somebody came and opened the door and let me out. It took that long for the scene to be secure and safe. And I sat there thinking, this is the time when somebody's going to have an asthma attack. This is when the diabetic kid's blood sugar is going to bottom out. This is the time that, somebody's going to have an anaphylactic reaction and I can't get to them. And then they don't have their medicine. So let's try to rethink our way of approaching this kind of stuff. So hopefully that will help. Our next question submitted is, in the past we were permitted to use the medication training from the prior year through the month of July. Is this allowed again? Unfortunately, no. That was just a provision when we were dealing with COVID. So things now have gone, we're trying to go back to the new normal. So the current delegation will only cover through June 30th. So you will need to make arrangements for training for any programs July 1st or after. And that's the only thing I have in the Google form. So I'll give it back to Jim.
I will ask our team to keep an eye momentarily on the soapbox. I also wanted to mention, I encourage you, if you have questions about the legislation and new laws that we discussed at the beginning of the call, please consult your board attorney because KDE does not provide legal advice, and each of your districts have the autonomy to develop and initiate those policies as you see fit and as they're interpreted by the law. So please take an opportunity to jump into those. Again, we want to extend our gratitude and appreciation for the work that you all do each and every day. We know that this time of year is very challenging, and maybe that's the best time for Nurse Appreciation Day that falls next week as well. So if we have no other questions, we will conclude our webinar with you today. As always, feel free to reach out to us at KDE or to Michelle and her team at KDPH, and we're happy to assist you. And unlike you all, we will be here through the summer months. So please let us know if we can help you navigate during that time as well.